Hi everyone, I am Dr. G, and once again I am coming to you from the United States of America. If you have been following my video series, then you probably have noticed that my hair is much shorter than it has been previously because, yes, finally after 3 months I was able to get a haircut. And not just one haircut, but two. Because the first haircut was given to me by my niece, Malia, who, by the way, is an amazing person. Malia, I'm sending some love to you, girl. You are awesome. I really appreciate it. You saved me from going full-on Wookiee. A week later, all of the barbershops and hair salons in our local area started opening back up, so I went back and got a second haircut to get it as short as it is now. And the reason I bring all this up is because some of this video was filmed between the first and the second haircut, and the rest was filmed after the second haircut, like this. So as this video progresses, you will see my hair magically grow and then shrink and grow again, which is actually a very closely guarded medical secret that I'm not allowed to tell you. But if you keep watching this video series, maybe I will reveal it in time. Today we're going to be talking about PPEs, which is personal protective equipment. What are they made out of? What are they good for? What are they not so good for? How do you use them? And so that's what we will be talking about in today's video. Okay, so you probably all know that PPEs are medical equipment that serves as a barrier between us and some of the contagious diseases that can cause infections and illnesses. Some of you have probably even used personal protective equipment at some point in your lives. Many of you have been using one form of mask or another since the whole COVID-19 thing started. And that seems like a pretty good place to start, so let's talk about masks. Let's start with cloth masks. Now, cloth masks are generally made of cotton, or at least they should be made out of cotton. That's the best material to use. And they are a woven mask, meaning that threads of cotton are laid down in an alternating grid pattern. This is an example of a cloth mask that my amazing wife put together for me, and it's probably similar to what a lot of you are wearing when you go to the grocery store or something like this. There are some advantages to cloth masks. They're very easy to make, and you can put them together at home with materials that you have at hand. They're very comfortable, they're very breathable, and they're sort of fashionable. You can have any sort of style that you want. But unfortunately, cloth masks, their fashion factor is much higher than their protection factor. And again, if you think of that alternating grid pattern, those holes in that grid are so large on a microscopic level that bacteria and viruses can get through them fairly easily. So they don't really protect against things like aerosols or things that are airborne. If you haven't seen my videos on the contagiousness of the COVID-19 virus or my video on whether or not the COVID-19 virus is airborne, take a look at those and this will make a lot more sense. But they do provide some protection against droplets. So things like splashes or sprays of blood or sprays that come from a sneeze or a cough, cloth masks do provide some protection against those sorts of things. It's not great protection, but it's definitely better than nothing. And they do have their place. If you are taking care of a person with COVID-19 or some sort of other respiratory virus, and they're very sick and you're spending a lot of time with them, cloth masks are not what you want to use. They're just not good enough. But on the other hand, if you are, say, in a grocery store and you're wearing your mask and people around you are wearing their masks and you're standing, 6 feet apart and it's a store that's big and open and well ventilated, a cloth mask in that situation is going to be just fine. That's going to provide you the protection that you need in that scenario. And perhaps one of the biggest advantages of cloth masks is that they simply remind you not to touch your face, not to touch your mucous membranes, again, your mouth, your nose, your eyes. Now let's talk about surgical masks. And the first thing to note is that there's all sorts of different types. There's lots of different sizes and shapes and colors, and it can get a little confusing which are which and what is good for what. This is an example of a surgical mask. Some people would actually call this a procedural mask. This is an example of a surgical mask that has a face shield attached to it. This is an impermeable plastic shield that protects your eyes when you're wearing the mask. But some of the things that you can say in general about surgical masks is that, once again, they provide protection against droplets, against sprays or splashes, and they do a much better job than cloth masks for these sorts of situations. But they're loose fitting. They do not form a seal around your mouth and nose. And so for things that are airborne or aerosols, they don't provide much protection against that. Surgical masks are made out of non-woven material, which provides better bacterial filtration and better breathability. The material that is most commonly used to make surgical masks is called polypropylene. They can also be made out of things like polystyrene or polyethylene or polycarbonate, or my favorite, poly-once-a-cracker. Now again, there are lots of different mask manufacturers, which means there are a lot of different types of surgical masks. And the terminology that is used in the industry really isn't very consistent. So it can get a little confusing, but there are some rules of thumb that you can adhere to that will make things make a little bit more sense. For example, you will hear the terms procedural masks and surgical masks. And although sometimes they are used interchangeably, generally speaking, procedural masks are lighter masks. They are a little bit more comfortable. They tend to have loops that go around the ears rather than actual ties that tie around the back of the head, and they provide less protection in general than surgical masks. The other generalization that you can make about surgical masks is that they are classified by the ASTM, which is the American Society for Testing and Materials, as being either level 1, 2, or 3. And again, this gets into some very technical stuff, and again, the terminology isn't always consistent. But the bottom line is, as the levels go up, the level of fluid resistance goes up before the mask becomes saturated. So a level 1 mask would provide resistance against very light fluids. A level 2 would be moderate, and a level 3 would be heavy. So a level 3 provides the most protection. Now, a step up from the surgical mask is an N95 respirator. And this is an example of an N95 respirator. It's got my initials on it because a lot of us have been in the position of having to reuse N95 respirators, and we'll get to that a little bit later on in the video. But these are a little bit different from surgical masks. It's called an N95 mask because, on average, an N95 mask will stop 95% of all particles that are 0.3 microns in size or bigger. And N95 masks can do this because they have a couple of advantages over surgical masks. The first is that they are molded and they are form-fitting, which means that they can form a seal over your mouth and nose, like this. The other reason is that they are permanently electrostatically charged, and this means that they can trap or repel a lot more viral or bacterial particles than a surgical mask can. And finally, there are what are referred to as PAPRs. Unfortunately, I don't have an example of this to show to you, but that's PAPR, and it stands for Powered Air Purifying Respirator. This is typically in the form of a hood or a facepiece that is connected via a hose to a HEPA filter that is commonly worn on the hip. This sort of mask is even better than an N95 because, in this case, the faceplate is an impermeable layer, usually of plastic. Generally speaking, this is the best sort of protection, the best sort of mask that you can wear in the hospital. But unfortunately, they're bulky, they're harder to use, and they're much more expensive. So generally speaking, hospitals only have a few of them that are reusable, whereas N95 masks, hospitals, generally speaking, have many more of, and they're usually thought of as being a one-time use sort of thing. Although, again, in the COVID-19 crisis, a lot of places, healthcare providers have had to reuse them. Now, there are some other types of masks and respirators, but those are by far the most common, so we'll stick to just those. But let's talk about some other forms of PPE besides masks. For example, gloves. Here's an example of some gloves. These used to be made out of latex, but some people have latex allergies, so we've largely stopped using those. Now they are made out of things like, for example, this is made out of nitrile rubber. They can also be made out of polyvinyl chloride or neoprene. They come in a variety of sizes, and some of them are powdered, so they are easier to slip on and off. The next thing we'll talk about are gowns, and I don't have an example to show you, but gowns are something that is worn to protect you from the neck, which is generally where your respirator or face shield stops protecting you, all the way down your arms to the wrist, and all the way down your torso and your abdomen and down your legs to your shoes. Some gowns are one-time use, and they're generally made out of plastic that is very thin but impermeable, and you throw those away. But sometimes they are made out of fabric, and those are washable. The last piece of PPE that we sometimes use are shoe covers and hair covers. But outside of the operating room, we don't use those very much, and they haven't played a very big role in the COVID-19 pandemic, so we won't talk about those very much. So that's the list of personal protective equipment that we use in the hospital, and these are the sorts of things that we have been using extensively in fighting the COVID-19 outbreak. Now, one last thing that I'll mention about PPE, and that's that most of these are designed to be one-use items. In other words, they are disposable. You use them once, they're contaminated, then you throw them away. There are some exceptions. For example, as I mentioned before, gowns sometimes are washable and reusable, and there's some other exceptions as well, but for the most part, they're intended to be disposable. However, as we have mentioned once or twice, in certain times and in certain places during the COVID-19 pandemic, healthcare providers and frontline providers and first responders didn't always have reliable access to as much PPE as they needed. And so in some cases, people were forced to look at reusing PPE, even though they were designed to be disposable. And indeed, we were forced to reuse some PPE in one of the hospitals that I work at for a short period of time. So what do you do in that scenario? Well, the first thing you have to do is realize that if you're going to be reusing personal protective equipment, you are increasing your risk of contamination and exposure to infection. It just sort of comes along with that proposition. But you can reduce that risk quite a bit by being very careful about how you take off and then subsequently put back on the PPE that you're going to be reusing. Now that you've got your PPE off, what do you do with it? How do you go about reusing it? Well, there are a number of different ways that have been looked at, and hydrogen peroxide baths or rinses, or heating the PPE to high temperatures to kill off bacteria and viruses, sort of spraying or spritzing them with isopropyl alcohol or essentially hand sanitizer, UV radiation, including sometimes just sunlight, which can be a good disinfectant, ozonation, and there are others as well. But if you want sort of a low-tech suggestion, if you don't have a lot of PPE and you're looking at having to reuse it and you don't have a lot of resources and you're not sure how you're going to go about doing this, one thing that you could consider is the following. Now, I should tell you that this is not a method that has been really rigorously studied, and so I can't guarantee that it will work, but in principle, it is sound, or at least it is with the COVID-19 virus. Because if you look at all the data that has come out, really there isn't a lot of data that suggests that the virus can survive very well outside of a host for very long. And specifically, it's somewhere in the range between a few hours and a few days. That's about how long it can last outside of a host. In other words, outside of our body or an animal vector body. And how long it lasts depends on the surface that it is on. So depending on whether the virus lands on plastic or wood or metal, etc., it will last a different amount of time. But pretty much, once you get out to about 3 days, regardless of the surface, all those viral particles have died off or have inactivated. So if you take that and extend that philosophy there, you basically can take PPE, use it. When you're done, you again take it off very carefully using the proper doffing procedure, the taking off procedure, and then you put that into a clean, cool, dry place where it's not going to be messed with, and you leave it there for at least 3 days, long enough for all the viral particles to die off. Now, I would personally recommend that you give it a little bit more than that just in case. Maybe you give it 5 days, or I've been actually using 7 days when I've had to do this. By that time, you can feel pretty good that those viral particles are all dead, and it's now safe to reuse that PPE again. And the advantage here is that you don't run the risk of damaging your PPE trying to clean it. For example, if you put it in a really high concentration hydrogen peroxide bath, or if you scrub at it, do you maybe disable some of the filtration features of the mask, particularly the N95 masks with that electrostatic charge? You know, you worry a little bit. Have you hampered that by trying to clean it? And I honestly don't know the answers to those questions, but you worry about that. Whereas if you just put it in a clean, dry place that's nice and cool, and you let it sit there for a week, you don't have to worry about damaging the mask, and the viral particles should all be dead now, and you can start reusing that. So if you have 7 sets of PPE, you can just go through them in sequence. Day 1, use them, put it away. Day 2, get the next one out, put it away. Make sure you keep them labeled so that you know which one is which, and by the time you get around to day 7, you're ready to use day 1 again. Alright guys, that's it for this video. Next up on my to-do list will be a video about COVID-19 and a potential vaccine, when and whether we can expect that. So be on the lookout for that. In the meantime, if you like this video or if you found anything useful about it, please hit the like button or subscribe or share with your friends. I would really appreciate it. But for now, stay safe out there, stay sane out there, and remember every day, try to find a way to make the world a better place. I'll see you soon.